We're doing Addison's disease. This is a part of the endocrine system, and this is our case study. A 55-year-old male, John Smith, presents to the emergency department. His chief complaint is that he has been feeling dizzy when he goes from a sitting to a standing position, which he's finding quite debilitating. He also states that he's been unable to participate in his usual activities because he is so fatigued and has been experiencing severe muscle weakness. He appears pale, but you note the darkened pigmentation around his lips and in the creases of his hands. While collecting a health history, he tells you that he works as an air traffic controller and mentions that at present he's off work due to a traumatic plane crash that has caused him a great deal of stress. Interestingly, he says his symptoms have increased since the event and is wondering if it could all be stress related. When asked about his diet, he states he's been having strong cravings for salty foods, which he normally doesn't like. You complete a set of observations and a urinalysis, and the results are as follows. The doctor suspects Addison's disease and orders blood tests for the patient, revealing low serum cortisol, low plasma aldosterone and hyponatremia, along with hyperkalemia, elevated plasma ACTH and elevated renin levels. For a more definitive diagnosis, the doctor also requests an ACTH stimulation test. This involves checking blood levels of cortisol first thing in the morning to get a baseline, and then administering ACTH to the patient IV and rechecking cortisol and ACTH levels at both 30 and 60 minutes after administration. If the cortisol levels remain low and ACTH high, it would indicate Addison's disease.